This is Jay Callahan again. Nice to see you again. And this is another one of our video mini lectures for the course Crisis Intervention. And today we're going to be talking about the epidemiology of traumatic stress. Now, if any of you didn't know what epidemiology meant in the past, you certainly have heard a lot about it now since the pandemic. So epidemiology is the study of the incidence and prevalence of physical illnesses or mental disorders in the community, not who comes in for treatment, but rather as it exists in the community. You know, you could do a survey of outpatient clinics or private therapist's office or medical centers and try to count up how many people with depression are coming in as a way to try to figure out how many people have depression in the community, but that would be way off because many people with depression in this example or many other illnesses or disorders don't ever come in for treatment for a variety of reasons. So the only way to really know the incidence, that is how many new cases per time period, and prevalence, how many total cases, is to do surveys in the community. So beginning about 20 or 30 years ago, headed up by a guy named Ron Kessler, you can see on the slide, who was on my dissertation committee all those years ago. He, as the principal investigator and many other people, conducted two major surveys of mental disorders in the United States called the National Comorbidity Survey and then the National Comorbidity Survey Replication. And these were some of the first major surveys of, again, incidence and prevalence of mental disorders in the community. There had been a couple earlier, but this was like, these were major nationwide studies and were very influential at the time and are still pretty much the state of the art now, even though years have passed. But many other surveys now around the world have used the same methodology that Kessler used. I mean, he didn't invent it totally; it came from many other people, but he was the primary investigator in these studies. So these were published in 1995, and then the second one was published in 2005. Each one surveyed about 5,000 people across the country. It wasn't just confined to traumatic events or anything like that. These were surveys of mental disorders in general, a full range. But for our purposes here today, we're going to focus on traumatic stress. They focused on a scientifically random sample of people across the country, between 15 and 54 in the earlier survey and 18 to 60 in the later survey. The traumatic stress part was the module in the interview. It's a structured interview that people conduct with respondents across the country. The PTSD module contained not only questions about symptoms people had, but about, in fact, obviously, whether they had experienced a traumatic event. If you recall from our brief discussion of acute stress disorder and post-traumatic stress disorder, the existence of a traumatic event is required to make that diagnosis, and this is one of these research areas where you would certainly not skip over that. So these surveys asked about a dozen or so questions about traumatic events, and they asked it in an interesting way because the surveys are normally done privately, but in fact when the interviewers get there, frequently there's no place to have a private interview in the house, or maybe it's a parent with a small child present, which makes questions about things like rape and sexual assault very awkward. And according to Kessler, and I think he was right, and some other people who are experienced in survey research, it's very likely that people would lie about it if they had to say yes openly. And so in the National Comorbidity Survey, then, they developed a little technique where they printed up a list of these traumatic events that I'm about to show you and handed each respondent a little booklet and said, now for this portion of the interview, I'd like you to consider the following events, and if you would turn to page 2 of that booklet that I just gave you, and I'm going to ask you about these, and I'm just going to name them by number, and you can answer yes or no just by the number of the event. And so, for example, one event might be, have you ever been in combat? and so on, so that the person didn't have to actually name anything. So the events that they asked about were combat, have you ever been in a life-threatening accident? Have you ever been in a fire, flood, or a natural disaster? Have you ever witnessed someone being badly injured or killed? Have you ever been raped? Have you ever been sexually molested? And there were definitions given for those. Have you ever been seriously physically attacked or assaulted? Were you physically abused as a child? Were you seriously neglected as a child? Were you ever threatened with a weapon, held captive, or kidnapped? And finally, any other event not on the list. And then also a miscellaneous one about other people. Did you ever suffer a great shock because one of the events on this list happened to someone that you're close to? So if you recall, people can experience traumatic events in 3 different ways. It happens to them, they witness it happening to someone else, or they simply learn about it happening to someone that they care about or are close to. And so that's the question that this one gets at. Okay. Now, before we go on, I just want to mention that these studies were influential in another way, and I would call your attention to one of the articles that I've asked you to read that's in the syllabus, an article by Bonanno called Loss, Trauma, and Human Resilience. And the subtitle of the article is, Have We Underestimated the Human Capacity to Thrive After Extremely Aversive Events? And this article by Bonanno, published in 2004, in part built on this earlier 1995 study that we're talking about. And the whole idea was, have we mistakenly thought that everybody who goes through a traumatic event is going to be terribly damaged by it, everybody's going to need professional help, everybody's going to have great difficulty, and we're focused on here the idea of resilience, and you can see the word resilience was in the title of the Bonanno article. In other words, these studies by Kessler, the National Comorbidity Survey, highlighted on the one hand how frequent the traumatic events are, but also how frequently people get through them with a lot of resilience. And in these studies, they focused on PTSD, so it would be the people who did not develop PTSD from many of these traumatic events, we would say, exhibited resilience. Now, the context of the times is important too, because in 1995, the federal building in Oklahoma City was blown up with the loss of several hundred deaths. And then, of course, 9/11 happened with 3,000 deaths. And so these were like major traumatic events in the community that highlighted at the time that people responded to with the idea that anybody who was exposed to those is going to be in big trouble, is going to be traumatized, and is going to really need a lot of professional help. And that was the kind of the belief of mental health people and of the public at the time. And this Kessler study that I'm talking about right now, as then later talked about in the Bonanno article, really highlighted, well, no, that's not true. That in fact, many people are resilient, many people do very well after really traumatic events happen in their life. And that really changed the mental health field in many ways, a whole different perspective on things. So just to focus on the straightforward findings, first of all about PTSD. So you can see the 4 columns on the left in this slide refer to the earlier study from the 90s. The 2 columns on the right refer to the later study in the early 2000s. I don't have the male-female breakdown for the later study, but I would just call your attention just to kind of like the bottom line here. Excuse me, that in the earlier study, a total of about 5% of the men and about 10% of the women have PTSD, for an average of 7.7. Now, this is a scientifically random sample that you can project and generalize to the whole population. So it is accurate to say at that time in the early 90s that 7.7% of the population had PTSD. In the later survey in the early 2000s, it's a little bit different. The total for men, 3.6%. The total for women, 9.7%. Overall, 6.8%. So as a takeaway, I would say the general kind of bottom line that people talk about in this field is, in general, of the whole population, about 5% of men and about 10% of women have PTSD. And so in the overall population, we would say the prevalence is about 7.5%. Okay, but again, twice as many women as men. Okay, so you can see that slide, and you don't forget, as you watch this video, you can always pause it if you need to look longer at it. Okay, I'm going to move on here. And more of our focus, for the purposes of talking about resilience, is the prevalence of traumatic events. So you can see here, again, I've listed the same traumatic events that we talked about already, and the proportion of the sample about 5,000 people altogether who had one or the other of these events. So for rape, for example, only 0.7% of the men had been raped or were willing to admit in the interview that they were raped, whereas for women it was 9.2%. Sexual molestation, 2.8% of the men, 12.3% of the women, and so on. And you can see down the list here. You can take a look at this. You can pause the video if you want to look at it a little longer. Here's the rest of it. I was always struck by this question that says witnessed, badly injured. The whole phrase is you witness someone being badly injured or killed. And the results are that 35% of the men said that they had witnessed someone being badly injured or killed. I don't know, I find that very striking. It's hard to believe it, that many. For women, 14.5%. But I don't know, maybe we're talking about bad car accidents here. But I would say in general, I don't question this methodology. This is the state of the art. And it just may be some surprising findings. Anyway, to jump to, I think the important conclusion here is, of all the men surveyed, 60% had had a traumatic event in their life, and 51% of the women had a traumatic event. So if you recall from what I mentioned in an earlier video, the definition of a traumatic event initially, back even in the DSM and in many studies in the 70s and 80s, would frequently include the phrase that a traumatic event is beyond the range of normal human experience, or beyond the range of usual human experience. And as you can see here, 60% of the men, 51.2% of the women, that's not beyond the range of normal experience. This is normal experience, unfortunately. And so that phrase then has been deleted from the DSM. And I can't remember whether it was first deleted from the DSM-3R, which was 1987, or at the latest it was the DSM-4 in 1994. So we've known now for a long time that these, unfortunately, are very common events in a lot of people's lives. So the final graph, the final chart I want to show you here speaks to resilience, but it also speaks to the varied impact of different kinds of traumatic events. And we haven't gotten to it yet, but I think in the next video that I'm going to record, I'm going to talk about the impact of various events, that different traumatic events have differential impacts on people. And as a general categorization, the traumatic events that are caused by people against people, that demonstrate human malevolence, that demonstrate human cruelty, these are the most impactful. These are the ones that hurt people the most. These are the ones that lead to PTSD the most, for example. Second in the hierarchy would be human error. Damaging and hurtful to people, but less so than if someone causes harm to someone else on purpose. And then at the bottom of the scale is traumatic events that are acts of nature, weather events, for example. And these are much less emotionally traumatic to people than the ones caused by other human beings, especially caused by other human beings on purpose. And we can see that in this graph here. You can see that as it plays out very clearly. I did not include all the traumatic events here, but just some of the major ones to show you some of the obvious differences. So at the top of the scale, of the respondents who had been raped, 65% of the men and 45.9% of the women got PTSD from it. Molestation, 12 versus 26, and so on. You can see that the events that were the most damaging to people, as measured by it causing them to have PTSD, were rape, sexual molestation, neglect, and physical abuse. And then on the other end of the scale, the traumatic events that were less harmful to people, as demonstrated by lower levels of PTSD, would be, for example, having been through a life-threatening accident, having been part of a fire, a flood, or a natural disaster, or witnessing someone being badly injured or killed. So these, as you can see the numbers there, the numbers of the proportion of people who got PTSD were much, much lower. So the second point I want to draw from this graph also is, well, some of these numbers are pretty high, some are not, but if you think to turn it around, it will show that many, many people experienced these traumatic events but did okay, did not develop PTSD. And if we use not developing PTSD as a measure of resilience, you can see that many, many people are very resilient, that they experience these terrible things happening to them and they get through it okay, without developing psychopathology, without it interfering with their life a lot. So the current view now, current dating back 20 to 25 years, is our general understanding about traumatic stress is a lot of people experience a lot of traumatic stress and really do pretty well about it. Right. Okay, so that's our video mini lecture for today, and I'll see you next time.